I'm about to share the top 7 things you can start doing today to help lower your risk of the leading cause of death in the US and the world. Did you know heart disease has been the leading cause of death in the US since 1950? Every 33 seconds, someone in the US dies from heart disease, and every 40 seconds, someone has a heart attack. If you're younger or generally healthy, you might be thinking, why should I care? Well, many of the contributors to the development of heart disease don't have symptoms. You don't feel levels of fat in your blood increasing or the buildup of plaques in your arteries. Most people don't know they have problems in key areas related to heart health until they're really far down the road. Today, I'm sharing the top 7 things you can start doing immediately that are going to help lower your risk of heart disease. Number 1, increase your weekly intake of fatty fish like mackerel, salmon, herring, and sardines. A serving is generally 3.5 ounces, and you want 2 to 3 servings per week. 2, swap simple carbs for more complex carbohydrates and slightly reduce overall carbohydrate intake. I'm not telling you to go low carb or keto, just a slight reduction from the standard American intake and a switch to more complex carbs will help. 3, increase intake of soluble fiber, aiming for at least 5, preferably 10 grams per day. You really don't need to count if you're eating a variety of whole foods like vegetables, whole grains, fruits, and legumes. You'll pretty easily hit that goal. And this ties back to number 2. Swapping some of those simple carbs for complex carbs will increase your daily soluble fiber intake. 4, aim to increase your physical activity towards 150 minutes of moderate aerobic activity per week. But we'll talk more about building up to this a bit later. 5, lower saturated fat intake. Cholesterol from foods actually doesn't have a huge impact on your cholesterol levels, but saturated fats do. We'll talk more about the debate around this one in the details, but as a general rule, reducing intake of processed meats, fried foods, and processed food like pastries are going to improve health in general. So start there if the idea of eating less meat and butter is a deal breaker for you. 6, maintain or lose weight. If you need to lose weight, losing as little as 5% of your body weight can improve blood lipids and start lowering your risk of heart disease. And 7, stop smoking and moderate alcohol intake. Smoking and alcohol intake more than 1 drink per day for women, 2 drinks per day for men are known to increase triglycerides, total and LDL cholesterol, and reduce levels of the good HDL cholesterol. That's the quick and dirty version. Starting to incorporate any one or more of these tips into your daily routine is going to help reduce your risk of heart disease.